Hello, this is Desiree Chappell. It's Tuesday. Welcome to the Roundtable, where we have in-depth conversation with the experts as well as those on the front lines of perioperative care.
Top Bed Talk.
I'm joined this afternoon by the nurses, my tribe of ladies. Today we have Robin Anderson, who is essentially the ERAS nursing coordinator at Duke. She's recently taken a new role there, but is well versed in coordinating a program. Bethany Sarosiek, is that correct how I pronounce? Yeah. She is the ERAS coordinator and leads a team of coordinators from the University of Virginia. And we also have Vicki Morton, who is the ERAS coordinator for Providence Anesthesiology in Charlotte, North Carolina. So come from a bit of a diverse background. Thank you, ladies, so much for joining us here at the ASER 2018. So I want to first talk about how you are using the team approach to care when you're leading the ERAS team in practice. Robin, you go first.
To start from the very beginning, we have a core team that includes a representative from surgery, anesthesia, and nursing at the core of our program. And then as we work on different populations or with different populations, we kind of look at who the key stakeholders are from those groups and who are their early adopters and those that can bring along their team. And from all of those entities, but across other subspecialties, including, case management or nutrition, pharmacy. Residents are very important if you are in an academic environment. So bringing those people together as we're developing pathways, and also they're very important in the implementation process.
Yeah. Bethany, I'm sure you've had similar experience, but how are you working with the team of coordinators or leading that team of coordinators to kind of bring everybody to the table? How is that working for you?
Sure. So my coordinators not only help to develop and implement new programs going forward, but they are really key in helping to sustain existing programs. So making pre-op and post-operative phone calls, doing chart audits, doing ongoing staff education. So they are key members of the team. But just to expand a little bit more on what Robin mentioned, not only do you want to figure out how best to engage your early adopters, but I find a really important part is identifying those late adopters and figuring out what are the issues and barriers to implementation from their perspective. Because if we can convince them to buy into it, it can make the implementation and adoption process much easier for us.
Vicki, I know you've done a lot of implementation. When you first implement a protocol and pathway, what are you using to ensure that sustainability of the program? Is that something that you think about at the beginning or kind of once you're already involved?
I definitely think about it from the get-go and trying to assess sustainability, number one, and what needs to happen. But through our data collection, we collect not only outcome measures, but process measures, and it's those process measures that help keep an eye on the compliance, which is going to lead to sustainability. So constantly looking at that, and if compliance goes down, then you have a problem and you need to try to fix it immediately.
Bethany, did you want to comment on that?
Sure. Just to add to that, I think in ensuring engagement along the way following implementation, what we do is we hold monthly and quarterly meetings after implementation to continue to re-engage the team, continue to assess the data and figure out, okay, well, we've got a new program up and running, but what new things have we identified that are issues to help figure out how best to navigate from there. So I think not even only thinking about that ahead of time, but thinking about that all along the process. We're, 4 or 5 years out from colorectal, and we still hold those quarterly review meetings where we re-invite everybody from the team to come together and review data and just get different perspectives from various team members.
Yeah, sustainability is such a huge issue. I mean, everybody's really excited whenever you first start these programs and can do it, and they're all compliant. But, a year, 2, 3 years down the road, if you're not continuing that engagement, it's never going to last, and you'll end up kind of right where you started.
I would echo, actually, what she just said in that leading up to implementation for the implementation planning with your ERAS committee or what have you, and continually following same day of the month, whatever that is, if it's once a month, it's a standing meeting on your calendar to get everybody together and hear what everybody has to say within each department was very much key. And now with 4 hospitals in our enhanced recovery program, it's something that we do consistently with every single hospital. And the ones that have been running longer, we may go every other month, but otherwise it is an absolute set meeting once a month.
continued. Robin, what would you say your top challenge is when you're starting out?
I think it's related to education. Everybody's focused on initial education and, educating everybody up front around the protocols and the, ERS principles and, workflow changes. But the amount of re-education required to gain that and to maintain that sustainability was eye-opening to me. I really didn't plan for that, or I wasn't expecting to plan for that. So that is really a challenging, because it's not only nurses, but it's physicians, residents, and then nurses in all of the different phases of care. So the amount of re-education and making sure, or thinking about who is going to be able to continue that. And many times it's some of the clinical nurses who really are on board and feel strongly and can educate others or mentor others. Sometimes it's people within your education departments, and that's going to vary.
Bethany, would you say that would be your top challenge?
I would say by far that is the biggest challenge, but another one is just the continuous changes of the protocol.
Yes.
So anytime new evidence comes out or our current state of drug shortages comes out, how do we then modify the protocol to still, stay true to the ERS concepts, but then further re-educate the staff, not only new staff that are in, but existing staff that have been practicing a certain way that now can no longer do so because of certain limitations.
Do you find a lot of pushback when that starts to happen? Whenever you have to evolve your protocol, or is everyone kind of just into it?
Because everybody wants to do the right thing, and of course, when we don't have any drugs to use, that's an ongoing thing. But not too much so far.
Good. Vicki, what about you? What do you think as far as challenges goes? Same experience? Other types of challenges? Do you think that are?
Yeah, I think the education, I would also say, is probably one of the biggest challenges, not because of pushback or anything like that, but more from a time perspective and organizing it and having nurse managers make it a mandatory education. These nurses, they do need to know when there are changes. They do need re-education, the new ones coming in. I have found that engaging our clinical education team or corporate education has really helped me in that regard, and so they're the ones that have been there most recently to continue on with that. I would probably say going back to the laggards in the group and trying to constantly re-engage them and bring them along, because especially if you have these laggards that are on the nursing floor, the floor nurses will make or break your program. And so if you have a large group of staff nurses that are not on board with this, it's a huge challenge to bring them along. But it has to happen.
Yeah, definitely some challenges. And I know that you get that question frequently, how you overcome that. Would you say, though, that there are any top questions that you're asked when someone does call you about, again, that they've been tasked with this new program? Where do you start? What do you do? What are the top, one or two questions that you hear? I know buy-in is a huge. How do you overcome those late adopters? Things like that. Is that what you're finding, or what are some of the other questions?
Can you send me your protocol?
Yes.
Because I think they don't even know where to begin. Because many institutions think that just having a protocol is going to put them in the ERS environment. So usually I start that conversation, sure, I'll be happy to send it to you and show you what we do, but it's going to have to be different for you and your environment. And so that's probably the top question.
Yeah, Bethany, would you say?
Probably the top question that I get has to do with that, or also where to start. So for those hospitals who are trying to get a new protocol up and running and don't necessarily have a coordinator role to start with, it's, well, who do you even get to help drive all of this conversation? Yeah. To which I'm honest and say it takes a lot of work and it takes a lot of extra time and engagement from an anesthesia provider, a surgeon, and a nurse who have a full-time job in addition to this sort of thing. But ensuring that they know once you have the data and can start to prove its worth, then it's easier at least to have that discussion with administration on getting a coordinator role established at their institution.
Yeah, it's kind of an uphill battle. You hear quite a bit. So, Vicki, would you say that there is another question that you get frequently? Pretty much.
Yeah, I would say the top question I get is how do you align hospital administration to support this? How do you get them involved and keep them involved? Because we all know that's so important to have their buy-in, one of the most important stakeholders. So, all
right. So thank you, ladies, so much for joining us this afternoon for the roundtable discussion.
Top Med Talk. Thanks for listening. Be sure to follow us on social media, Twitter, LinkedIn, and Facebook, and subscribe to our newsletter, where Monty and I give you highlights from the previous week. Also, check out our calendar for the next Top Med Talk event. You've been listening to the Roundtable on Top Med Talk. Have a great day.